Well, I think the thing that attracted me to oncology is that you're both a specialist and an expert in something, and at the same time, the patients have really long-term relationships with you, and so you almost become like a primary caretaker to many of them because so many of their needs revolve around their cancer. And I really enjoy those long-term relationships. I also enjoy the complexities of medical things that go on, and it's nice to try to be able to work with those patients and try to get the best outcome. For a long time, obviously, there were sort of incremental advances that mainly were utilizing chemotherapy, and I think the first big breaks came in the early 2000s, and then a lot of big changes subsequent to that where we're getting away from just standard chemotherapy and going more into either targeted therapies that either attack a specific part of the cancer cell or immune therapies that use the body's immune system to fight the cancer. And I think that those sort of therapies are becoming more and more applicable to more and more types of cancer and are a big advance, obviously. So the options have changed a lot, even in the last few years. Clinical trials offer several things. First of all, they offer the chance to be on the cutting edge and be involved in new therapies that might improve the outcome. The second thing is that in addition to that, sometimes we don't have the best options, and it's nice to have other options available on a research basis to give patients a chance to do something new that might help them out when standard treatments are no longer really able to help. It's obviously tremendously exciting. I mean, when you look back over the 15 years I've been in practice, you'll see patients, and frankly, most patients now are treated with something which wasn't available 15 years ago. And it's particularly exciting when you've got a patient that there maybe is not any good option, and all of a sudden one day there is. So drugs like the immunotherapies have just recently become available for small cell lung cancer, and then you'll have a subset of patients who can get just these phenomenal responses. And if they had been around a year ago, they probably wouldn't have made it. And now they appear to be having just dramatic responses that hopefully can be durable. And it's very exciting. And there absolutely are numerous other therapies available where patients used to get a certain response and it might not be that good, but now we're seeing these tremendously improved responses with newer agents and often with less side effects as well. So it is very, very encouraging. Yeah, people live for several years or many years, whereas before they might just live a year or two. And so it's just been a very rewarding, stepwise advance in treatment.